Imagine waking up, doing your morning workout, beating your personal running record, and 3 hours later fighting for your life on a cardiac surgery table. This happened to James Fix, the man who popularized running in the United States. Author of the bestseller The Complete Book of Running, he ran 100 kilometers per week. He died at 52 years old from a heart attack. How does someone like that die from their heart? The answer is disturbing. Your heart could be failing right now, and your body won't tell you. In this video, I'm going to show you why the health you feel is not the health you have, the fatal mistake that 80% of people make, and the 3 things you need to check before it's too late. Here's the problem. Your body is a professional liar. Think about it this way. You have a car, the engine has an oil leak, but the car adapted. It automatically reduced power, adjusted cooling, compensated for the failure. You drive every day, everything seems normal. Until one day, in the middle of the road, the engine explodes. Your heart does exactly this. Let's understand what's happening inside your chest right now. Your heart is the size of your fist, but it beats 100,000 times a day. To do this, it needs oxygen, a lot of oxygen. This oxygen comes through vessels called coronary arteries. Think of them as garden hoses. If water flows freely, plants live. If you step on the hose, they die. But here's the trick. Your body doesn't let you feel the hose being stepped on. Why? Because there are 2 adaptation mechanisms that hide the problem. First, the artery expands. When fat plaque begins to grow inside the vessel wall, the artery literally widens to compensate. It's as if the hose got fatter, but the hole where water passes through stayed the same size. You can have 40%, 50%, even 60% of accumulated plaque and blood flow remains 100% normal. Second, secondary vessels grow. If a road has traffic, your GPS creates alternative routes, right? Your heart does this. It creates small bypass vessels called collateral circulation. These 2 mechanisms are incredible and dangerous. Why? Because you're having a heart attack in slow motion and feeling great. There are 2 ways your heart can stop, and the most common one is not what you imagine. Path 1, the time bomb. Imagine that inside your artery there's a pus bubble. It's covered by a thin layer like a pimple about to pop. This bubble is the unstable plaque. It's made of oxidized cholesterol, inflammatory cells, calcium, and cellular waste. And it's covered by a thin fibrous cap. Now, what happens if you have a blood pressure spike, suddenly do extreme physical exertion, or go through intense emotional stress? This cap ruptures. When it ruptures, the plaque contents leak into the bloodstream. Your body sees this as an open wound and goes into emergency mode. It sends platelets, the clotting cells, to plug the hole. In 5 to 10 minutes, a giant clot forms that completely closes the artery. 0 blood, 0 oxygen, heart muscle dying. This is a type 1 acute myocardial infarction. And here's the sinister detail. This happens in arteries with less than 50% obstruction. Large, stable plaques rarely kill. It's the small, invisible, and unstable ones that explode. Path 2, the silent blackout. Now imagine another situation. You have a 60% obstruction in an artery. Sitting on the couch, no problems. Blood flows slowly, but it flows. Then you decide to run 10 kilometers. Your heart rate goes from 60 to 170 beats per minute. Your heart now needs 3 times more oxygen. Can the obstructed artery deliver? No. It's like trying to fill a pool with a clogged hose. Demand exceeds supply. The heart muscle begins to suffocate. Cells die. They release a protein called troponin into the blood, the biochemical signal that cell death has occurred. You had a heart attack, but when doctors look at your arteries, they don't find 100% blockage. This is a type 2 heart attack, the excessive demand heart attack. And it's extremely common in athletes who push too hard without knowing they have partial obstructions. You might be thinking, but I exercise. If something was wrong, I would feel it. No. And here's why. The 70% rule. You only feel symptoms when an artery is obstructed by more than 70%. Below that, total silence. And even above 70%, the symptom isn't heart attack pain. is just mild discomfort when climbing stairs that goes away when you rest. We call this stable angina. It's like the maintenance required light on your car. Many people ignore it. Why are athletes surprised? Because they have good collateral circulation, the bypass vessels I mentioned, a heart adapted to exertion, beats slower, pumps more volume, and plaques that haven't reached 70% yet. They pass all conventional stress tests until the day a 40% plaque ruptures. The difference between young and old, a cruel detail. A heart attack at 70 years old has a better chance of survival than at 40. Why? Because the 70-year-old heart had decades to build collateral circulation. When the main route closes, there are alternative routes. The 40-year-old heart didn't have that time. When the artery closes, there's no plan B. Death is instantaneous. Your body tries to warn you, but the signs aren't what Hollywood taught you. For men, the classic signs are chest pressure, not pain, pressure, like an elephant sitting, pain that radiates to the left arm, jaw, or back, cold sweat, and shortness of breath. For women, it's much more treacherous. Extreme fatigue, you feel exhausted for no reason, nausea or severe heartburn, back or shoulder pain, shortness of breath without chest pain, and a feeling that something is wrong. Don't ignore your instinct, the symptom that should never be ignored, a sudden sense of impending doom. It sounds dramatic, but it's real. Your nervous system senses that something catastrophic is happening and triggers a primitive alarm. If you feel this, call emergency immediately. Time is muscle. With each minute that passes without treatment, 20 minutes, irreversible damage begins. 90 minutes, heart tissue turns to scar tissue. Scar tissue doesn't pump blood. Now, the part that can save your life. There are 3 pillars of prevention. Pillar 1. Control risk factors. These are the scratches that allow plaque to form. Blood pressure below 120/80. Above that, you're mechanically scraping your arteries. Blood glucose, glycated hemoglobin below 5.7. Elevated sugar inflames and oxidizes cholesterol. Cholesterol, it's not enough to look at the total. You need to know. LDL, the bad one, ideally below 100 milligrams per deciliter. Some cardiologists recommend below 70 for high risk. HDL, the good one, above 40 milligrams per deciliter. Triglycerides below 150 milligrams per deciliter. ApoB, a polypoprotein. B. This is the test few people do, but that shows the real number of LDL particles. Ask your doctor. Inflammation. High sensitivity C-reactive protein. If elevated, it indicates chronic inflammation. Stop smoking. Each cigarette is sandpaper on your arteries. Pillar 2. Smart exercise, not excessive. Exercise saves lives, but poorly done exercise can kill. What works? Zone 2, light aerobic, 60 to 70% of your maximum heart rate. You can talk while training. Do 150 to 200 minutes per week. Why? It stimulates capillary growth and collateral circulation. It's literally paving bypass routes in your heart. Strength training, 2 to 3 times a week, improves insulin sensitivity and controls pressure. HIIT, interval training once or twice a week, short sessions. Improves cardiovascular capacity. Warning: if you're sedentary and decide to become an athlete overnight, you're creating demand without having built supply. Start slowly. Get a checkup first. Pillar 3. The tests you need to do. Here's the mistake 90% of people make. They do blood tests and think they're protected. Blood tests show what's in the blood. They don't show what's stuck to the artery walls. You need direct imaging. Test 1. Coronary artery calcium score, CAC score. What is it? A quick CT scan, 5 minutes, that measures how much calcium, hardened plaque, exists in your arteries. Result: 0, perfect, very low risk. 1 to 100, mild plaque, attention. 100 to 400, moderate plaque, action needed. Above 400, time bomb, aggressive treatment. When to do it? Men over 40, women over 50, or earlier if you have risk factors. Limitation: only sees hardened plaque, doesn't see soft and dangerous plaque. Test 2. Coronary CT angiography. What is it? CT scan with contrast that shows inside the arteries. What does it see? Soft plaque, the dangerous one, hard plaque, exact degree of obstruction, complete anatomy of the coronary arteries. When to do it? If the CAC score came back altered or if you have multiple risk factors. This test is the non-invasive gold standard. It sees what blood doesn't show. Test 3. Exercise stress test, treadmill. What is it? You run on a treadmill while monitoring heart and pressure. What does it show? If the heart can sustain effort without signs of ischemia. Limitation. Only detects obstructions above 70%. Small dangerous plaques go unnoticed. Tip. Combine with imaging test for a complete evaluation. Going back to the initial question, why can your heart fail without warning? Because it's programmed to keep you alive until the last second. It compensates, adapts, creates bypasses. But these adaptations have limits, and when the limit is reached, you don't have second chances. The 3 things you should do now. 1. Control your numbers, pressure, glucose, cholesterol, inflammation. 2. Exercise intelligently, zone 2, plus strength, plus moderate hit. 3. Do the right tests, CAC score or CT angiography if you have risk factors. Don't wait to feel symptoms. When you feel them, it may be too late. Don't guess if you're healthy. No. Use the technology that exists. Talk to your cardiologist. Request the tests. Your heart is beating now. Make every beat count. If this video made you think differently about heart health, leave your like, share with someone who needs to see this, and subscribe to the channel for more content that can save lives. See you in the next video. Take care.